Specifically, I'd like this hearing today to examine some of the following issues. First, what is being done to study the adverse reactions reported in the vaccine adverse event reporting system? Second, do the benefits of administering the vaccine to infants outweigh the risks? Third, what process does the CDC employ to make a recommendation for a vaccine? What role do pharmaceutical companies play in that process? And do conflicts of interest exist? Fourth, what disclosure is required before the vaccine is given? And is that disclosure adequate? Let me introduce the panel, and I think, again, Mr. Tierney has given an introduction to Joe Moakley. We also have Michael Belkin. We have Judy Converse. We have Marilyn and Lindsay Kirshner. We have Barbara Hahn, and we have Karen with PKIDS. I guess it's P Kids, and she will be testifying. In addition, we have Betty Fluck. That's our first panel, and again, all of these individuals have some personal relationship and experience with the problem of hepatitis B. Except for Mr. Moakley, we don't swear in our members of Congress, but this subcommittee and our committee is an investigations and oversight subcommittee and committee of Congress. So we do swear in our witnesses. And again, with the exception of our member, if you could all please stand. Or if it's convenient, be seated. Thank you. Would you raise your right hand? Do you solemnly swear that the testimony you're about to give before the subcommittee of Congress is the whole truth and nothing but the truth? The witnesses have answered in the affirmative, and I'd like to take this opportunity to again welcome each and every one of you for participating and for coming forward and providing this subcommittee with your important testimony and personal experience.
Thank you for holding these hearings, Mr. Chairman. First of all, I'd like to submit into the record 25,000 adverse reaction reports from the government reporting system in those boxes there, and my recorded testimony, which is an investigation of those reports.
Well, I don't know if we'll be able to submit all of those in the record, but what we can do is make reference to them, and they can be kept with the committee. I think that would be appropriate. Is that acceptable?
It's fine.
Okay. If we'll do that, because it's almost impossible to include all of those in the report, but we will make reference to them, and they'll be kept with the committee records without objection so ordered. Continue, please.
Okay. My daughter, Lila LaRose Belkin, died on September 16th, 1998, at the age of 5 weeks, about 15 hours after receiving her second hepatitis B vaccine booster shot. Lila was a lively, alert 5-week-old baby when I last held her in my arms. Little did I imagine, as she gazed intently into my eyes with all the innocence and wonder of a newborn child, that she would die that night. She was never ill before receiving the hepatitis B shot that afternoon. At her final feeding, she was extremely agitated, noisy, and feisty, and then she fell asleep suddenly and stopped breathing. The autopsy ruled out choking. The New York medical examiner ruled her death sudden infant death syndrome. But in the notes and in the conversations with our pediatrician and with us on the day of the autopsy, this is in the pediatrician's notes, what the coroner said. Brain swollen, not sure cause yet, could not see how recombinant vaccine could cause problem. SIDS is a diagnosis of exclusion. It means it's not this, it's not that, it's not something, it's not, a swollen brain is not SIDS. And it turns out that in the medical literature, a swollen brain inflammation is one of the most common signs of an adverse reaction to a vaccine. So I set out to do an investigation of this vaccine and adverse reactions and the disease, and these are my conclusions. And I urge you to read, I have some prepared remarks that are far too lengthy to completely summarize here. First of all, let's look at vaccination policy in this country, this Rube Goldberg flowchart that I have. This committee is up here. It has oversight over the CDC, which has oversight over the ACIP, the Advisory Committee on Immunization Practices. This committee sets immunization policy. And I urge you to really concentrate on this. I think there's a conflict between the public interest and the private interest of drug companies and the interests of the bureaucracy that are violating the public interest. And as an oversight committee, I think this is something you should look into. This committee sets mandates which go out to the states, which go down to the children, and then some small percentage of children have adverse events which go into this thing called VAERS, Vaccine Adverse Event Reporting System. And from VAERS, they go into an empty drawer, and they pile up, and they go nowhere. And nothing is done. And the CDC and FDA do studies saying we don't see any problem with anything. Can you please change the chart? First of all, newborn babies are not at risk of getting this disease. I quote you the risk groups from the CDC Hepatitis B disease fact sheet. Injection drug users, sexually active heterosexuals, homosexual men, infants from disease endemic areas, low socioeconomic area level, sexual household contacts of infected persons, infants born to infected mothers, healthcare workers, hemodialysis patients, not newborn babies. Then why do you say our newborn babies, this is the first thing they get in the first 24 to 48 hours of their lives in the hospital? Here's the ACIP's original statement from 1991. In the United States, most infections occur among adults and adolescents. Efforts to vaccinate persons in the major risk groups have had limited success. In the long term, universal infant vaccination would eliminate the need for vaccinating adolescents and high-risk adults. And then they say, hepatitis B vaccination is recommended for all infants. The first dose can be administered during the newborn period, preferably before the infant is discharged from the hospital. That's where it came from. I quote you from government statistics, summary of notifiable diseases, 54 cases of hepatitis B in the 0 to 1 age group in 1996. And if we compare that, that's that. In the VAERS reports right there in that year, there's more than 1,000 adverse reaction reports, and there's 47 deaths in these reports. So this needs to be investigated. I'm not saying that every report in VAERS is directly related to the vaccine, but I have torn apart the VAERS data, and I'm trained in statistics. I'm an advisor to some of the largest financial institutions in the world, former proprietary trading strategist at Salomon Brothers. One of the most striking findings I've found in this data is that almost 80% of the reports of hepatitis B only, 77% are in females, 23% in men. More than 3 times as many women are having adverse reactions reported in VAERS. No one's looking at this. Dr. Chen of the CDC dismisses it and says nurses tend to over-report. I think that's a big mistake. I think independent doctors with no financial interest should take a look at this. And I'd just like to conclude with the way vaccine policy is set in this country. Dr. Modlin, at the ACIP meeting in February 19th, which I attended in Atlanta, said, First of all, he said at a debate in New Hampshire, how do we decide something? Is the theory biologically plausible? Has it been tested by appropriate methods? Is the study well concluded? Are the results statistically sound? Now I read to you from the transcript of the ACIP meeting where they approved rotavirus for premature infants. Available data are insufficient to fully establish the safety and efficacy of rotavirus vaccine in premature infants. There's a section under adverse events that details what little information there actually are with respect to premature infants. To my knowledge, we don't have data from a clinical trial specifically. Some bit of information, as I recall, that had just suggested there was a slight increase in relative risk for hospitalization. Obviously, a situation where we have to make a judgment in the absence of data, and with a vaccine that has not yet been tested in this group. They voted 9-1 to approve rotavirus vaccine for premature infants with no scientific statistical studies on it. I think that's a big problem, and this is my charge to you. I'm afraid that that this vaccine policy is dominated by forces that are not in the public interest. And this committee should investigate the 1991 ACIP recommendation establishing universal hepatitis B vaccination of newborn babies. And if, as with the rotavirus vaccine examples were done, no studies were done to prove that this was safe in a broad sample of racially and genetically diverse babies less than 24 to 48 hours old, when they established this recommendation, and we can find those studies, we have a Freedom of Information Act in, a request from the National Vaccine Information Center, then the CDC has been experimenting on babies like guinea pigs. And this committee should suspend that universal at-birth immunization policy. Thank you.